Hi, my name is Debbie and I am a nurse within the acute pain service at Royal Bournemouth Hospital. Recently we have introduced a new service offering cognitive behavioural therapy for patients who might be worried or anxious about their upcoming hip or knee replacement surgery.
Cognitive behavioural therapy for trying to help people manage post-operative pain is very useful. What we find is that people have individual concerns, either about the operation or about the post-operative recovery. What we find is that by exploring those concerns, people tend to feel better. When people feel better and are more in control, then they tend to recover better from their operation and quicker, which is all quite useful. We can look at ways of working with our thoughts and our behaviours to try and help people manage their pain and cope after an operation. It's useful to explore how pain works. It is a combination of what's going on in the body and in the mind. So we can work with our mind and our body and our behaviours, and what we find is then people feel better, they cope better, and they recover quicker and better.
The original idea for the project came from noticing that lots of patients were quite anxious about their surgery. We felt by identifying patients at an early stage who were anxious about surgery and offering them our service, we felt we could improve outcomes and people would have a better experience in hospital.
When I was approached by the pre-operative psychology service, I was a bit daunted. I thought, oh gosh, and I went away and thought about it, and I thought, I'm very nervous about this operation. They say it's very painful, and I thought any help that I could get would be beneficial. They said it was a trial, but it offered me very practical help.
Over 100 patients have so far received this treatment, and the results have been really positive. What we find is that we get a reduction in the time people spend in hospital post-operatively.
It empowered you and it made you feel part of a team working towards your recovery and your best outcome. And it made you accept that there will be good days and bad days. And it was just extremely helpful.
So we're really pleased with how the project's gone. We're a year down the line now. Patients have really embraced the project. They've really found benefits from talking to somebody pre-operatively. It's meant that they're much calmer and much more in control when they do come into hospital, and they know what to expect more.
If they're going to use the pre-operative psychology service, you've got to have an open mind. Some of the strategies might seem a bit strange, but it really does help. It's like having a toolkit. So I'm extremely grateful and so delighted that it seems to have worked.
You may have up to 3 one-to-one sessions here at Royal Bournemouth Hospital, and these will last 45 minutes each. If you're interested or you would like more information about our service, please speak to your nurse at your pre-assessment appointment.